Xin chào mừng quý vị quay trở lại với chương trình Tôi và Việt Nam trên kênh truyền hình FBNC với cuộc trò chuyện cùng ông Jay Thyagarajan là tổng giám đốc phụ trách các thị trường mới nổi Đông Nam Á của tập đoàn dược phẩm Novo Nordisk của Đan Mạch. Hi Jay, welcome back.
Thank you.
So how would Novo Nordisk making a difference running the business in Vietnam versus other pharma companies?
Novo Nordisk is a very focused healthcare company specialized in diabetes care. And we also have products for hemostasis, women's healthcare, and growth hormone. And our business approach is based on a concept called triple bottom line.
Triple bottom line.
Yes.
Okay, could you kind of explain that a little bit?
A triple bottom line is a concept of business approach that brings in a fine balance between financial commitment, social commitment, and environmental commitment.
Okay.
So, of course, you need to be financially focused in order to generate profit, to invest in R&D, and to bring in more new innovative products. But at the same time, we need to balance that with social commitment of making a difference to the society that we live in. And that's what we are doing also in Vietnam by launching the free diabetes changing village and also the van that goes to the provinces to screen the patients. And we do all of this to be environmentally conscious. All our products are biodegradable, and therefore we also take care of the environment in the process.
I read on the news saying that the pharma companies, a lot of them are cutting jobs in recent years. So why is Novo Nordisk opening a new office in a new market and recruiting more talents to the office?
I think when you look at emerging markets, we wanted to focus beyond the BRIC countries. And that's where we identified Asia as our focus, with Indonesia, Vietnam, Malaysia as a key driving force. And Novo Nordisk is a very long history in diabetes, and we always look at long-term presence and how do we make long-term difference to the society that we live in.
Sure.
And that is one of the reasons we may have challenges short-term now from the economic downturn and other challenges. But I think we are very much focused on making a difference to the society from a long-term perspective.
So improving awareness for the community, I mean, from your experience, what are some of the typical misunderstandings from the community towards diabetes treatments?
Diabetes is a progressive disorder.
Okay.
It progresses over a period of time. And the stages in which you can control diabetes starts with prevention, actually. You can prevent diabetes from happening to you. And the way to do that, the first step is to ensure that you have a healthy eating habits, right?
Like how?
Because now when you look around you, you see the advent of all the fast food chains.
Oh, yeah.
All the
opening
burgers
a lot of
and the
stores
pizzas,
in Ho Chi Minh City.
absolutely. And that, of course, changes. I mean, in Vietnam, the diet is very, very healthy with lots of greens and vegetables.
Yeah.
But, of course, with more disposable income, the lifestyle changes, the living habits changes, lack of exercise. That, of course, results in obesity and overweight. In Vietnam, there are 3% of men who suffer from obesity and 4% of women who suffer from obesity. And obesity is a major cause for diabetes.
Really? So there's connection right there.
There's a very, very
between
strong
obesity
correlation.
and diabetes.
Absolutely.
Wow.
If you are obese, you have a 7 times more risk on developing diabetes.
Wow, that's dangerous.
And if you are overweight, it's 60 times higher that you get the probability of diabetes.
Okay.
So in order to address that, of course, you need to make changes in the diet and exercise. And then, of course, follow it up with oral tablets. And if they are not controlled with the oral tablets, then you progress on to insulin. Some of the misconceptions that people have when it comes to diabetes is things like eating more sugar, and then you get diabetes and stuff like that.
That's not true, right?
That's not true. There are a lot of misconceptions that the insulin is the last resort and you are in the final stage of your disease and things like that. All insulin does is when a patient gets diabetes, the production of insulin comes down drastically, or in some patients, it's not at all produced,
Okay.
like in children. In type 1 children, there's no insulin produced at
So
all.
children still have a risk of having diabetes.
Diabetes.
And what age? Starting at what age? Any age?
We have seen patients below 8 years of age who have diabetes. Sad, but
that's not because of the eating habit. That's something.
no, that's genetic.
Okay.
So there are many causes. In children, it's predominantly hereditary and genetic. But in adults, of course, it's all the lifestyle and the lack of exercise. And once they get diabetes, they have to take care of their lifestyle and ensure that they replace the insulin from outside. So since the body cannot produce insulin, you just have to give it from outside. And that's what we do as a company, providing insulins, replacing what the body cannot naturally produce.
In order to make it effective in Vietnam, the Vietnam Diabetes Care Program, you have to work with the local doctors as well, right? So how do you plan to cooperate with them effectively?
I think the first step has been very good for us in terms of forming a partnership with Ministry of Health. And Ministry of Health has been very forthcoming in signing this Memorandum of Understanding. As part of this program, we will work together with the Ministry of Health to identify the key hospitals that will be part of this program, and as a result, the key doctors and physicians who will be involved in rolling out and implementing these programs in Vietnam. And that's how we intend to work with the doctors. The concept is, since it's a long-term project of 3 years, we will identify a network of hospitals first, maybe 5 to 10 hospitals, which will become the center of excellence to provide diabetes care. And then they will then identify 10 hospitals each that they will train and upgrade over a period of time to provide diabetes care. And then those 10 hospitals that have been identified will then, once they get upgraded, will then deliver care to the next 10 hospitals. And that's how we slowly intend to cascade down all the way to the provincial levels.
But where do they get the training from? Would you help in that process, training the doctors?
Yeah. Novo Nordisk invests a lot in research and development and also training. Globally, we have one of the few companies that invest more than 500 million euros in research and development.
Okay.
And we have more than 3,500 people globally working on R&D and training. As part of that, we also have instituted a hospital.
So you have your own hospital?
Hospital in Denmark, called the Steno Diabetes Center. We are now working together with the Ministry of Health to collaborate with the Steno Diabetes Center, which is a world-class international standard education system that they roll out to many different countries.
Okay, including Vietnam.
Including Vietnam.
Oh,
so we will bring them to Vietnam, and then we'll form a partnership, and they will then train our doctors in Vietnam in the field of diabetes.
Okay, great. Good news. Thank you for sharing. We'll come back with that after a short break.
Sure.
Thank you. Thưa quý vị, vừa rồi là phần 2 của cuộc trò chuyện cùng với ông Jay Thyagarajan, là tổng giám đốc của phụ trách các thị trường mới nổi Đông Nam Á của tập đoàn dược phẩm Novo Nordisk của Đan Mạch. Mời quý vị giải lao trong ít phút trước khi quay trở lại với phần cuối.